We're happy to have Delicia Haynes, and she's a doctor. And normally you don't think about innovation and entrepreneurship within the medical community, but I think you're going to hear some interesting things. She's taking some risks that entrepreneurs will be familiar with, risks with a different business model than doctors normally follow. Give a warm welcome to Delicia Haynes.
Well, good morning. Thank you. Good morning. Thank you for coming out. So I'm going to start with a couple of questions. How many of you have ever been to a doctor's office? Okay. How many of you enjoyed going to the doctor's office? Okay. How many, when you go to the doctor's office, you wait for less than 5 to 10 minutes before you get brought back from the waiting room into the examination room? Okay. How many of you, if you wanted to do a virtual visit where you didn't physically have to come into the office, but you could do it through like a web chat or a Skype type session, can do that with your physician? How many would like to if that was offered to you? Okay. So my name is Dr. Delicia Haynes. I'm an integrated family medicine physician, board certified in family medicine and in obesity medicine. And my goal today is really to build your ideal clinic. That's really what it's all about. And I think that all really good physicians were at one point in their life patients, because it gives you that perspective. So when I was in the 7th grade, I was taking a shower one day, and I felt a lump in my breast. And at first I was kind of okay with it because I wasn't the most voluptuous person, and so I was hoping if I got one on the other side that I would kind of like be evened out. And that lasted for about 2 seconds, and then I got really scared. But I didn't want to tell anybody or show anyone because I knew I would literally have to bare my chest in order for them to do something about it. So I stayed in denial. I just hoped it would go away, and it didn't. And two months passed, and it was still there. And I was so scared that I went ahead and I told my mom. So my mom took me to the doctor's office. And I remember we waited for about an hour or 2 hours in the waiting room, and then we got brought back into the examination room. And it was this cold blue room, had blue peeling paint, and we sat there, and all of the environment itself was really uninviting. I was excited because at that point, or up to that point, I knew that I either wanted to be a doctor, a teacher, or a lawyer. And I found out that if I became a doctor, I could do all three. I could teach my patients and empower my patients. I could also teach medical students. I could advocate for my patients, which is the part of law that I liked. And I could heal people, which is what really attracted me to medicine. And we didn't have any physicians in my family. If we did have a family business, it would be the mortuary services, which I try really hard not to support the family business. But we didn't have any physicians in my family, so I was looking at this as an opportunity for me to meet someone who could be a future colleague of mine and maybe a mentor of mine. So I was really excited. So another hour passes, and finally in walks the doctor, and me and all my 7th grade enthusiasm says, I want to be a doctor too. And he looks at me over his glasses and says, take your top off. And I looked at my mom, and she looked at me and she nodded that it was okay. And so I took my shirt off, and he just walked over and just started pressing on my chest. And then he stepped back and he wrote in his chart, he said, it's probably benign fibroadenoma. We won't know for sure until we have it surgically removed. Due to the location, the surgery scar will be small, so if you want to be a stripper when you grow up, that'll be fine. And he walked out the door. Now, my mom is a Baptist deaconess, so needless to say, that did not go over well with her. And I was devastated. I didn't know what benign meant. I didn't know what a fibroadenoma was. But I knew what surgery was because I had been watching the Surgery Channel because I was interested in medicine. And I started to cry, and I looked over at my mom and I said, Mom, they're going to cut me. And she said, Delicia, put your shirt on, I'm going to go talk to the doctor. So she went out and tried to find the doctor, but he was already in another room and wouldn't talk to us. And so at that moment, I decided that when I became a doctor, I was going to be the type of doctor that I wish I had. The kind of doctor that doesn't make you wait for hours in the waiting room for a 5-minute appointment. The kind of doctor that doesn't do 5-minute appointments. The kind of doctor that explains everything to you in layman's terms, in plain English or plain Spanish, in ways that you can understand. The kind of doctor that, if you didn't get all your questions answered at the time or you forgot what they said, you can call back later and you can get that done. You can understand. So that's what I set off to do. So I went to undergrad at the University of Louisville, went to medical school at the University of Kentucky, and then I moved in 2005 to Daytona Beach to complete my family medicine residency at Halifax in Daytona Beach. And I got to my third year, and it was like, okay, now what? You've got the credentials, you've got the training, and a few colleagues and myself, we said we're going to open our clinic together. And one by one, they decided this is probably not the best idea. We don't have any business background at all, so we should probably just kind of become employees somewhere and then do it. But I really felt like I was supposed to start it then. So, I prayed about it, and I got, the green light, and so I set off to, start my clinic. And I started meeting with individuals, I started meeting with mentors, and I started talking to attendings who all were really scared for me. And they said, have you seen the medical environment? This is not a good idea. You should not do this. So, I went back and I prayed again. And I got a larger green light that this was what I was supposed to do. And I started meeting with business strategists. And in 2009, I opened Family First Health Center in Daytona Beach. And I was introduced to the medical bureaucracy, the business side of medicine, the side that in residency I had been sheltered from and I didn't really know existed. So I was working about 13-hour days and seeing patients, and I loved that part. But the paperwork and the billing and the coding and the insurance hassles were taking its toll. I had to hire more and more staff, not for seeing patients, but for dealing with the bureaucracy, trying to get paid, trying to chase claims, and that sort of thing. And a little bit about me, I think that the well-informed patient is a therapeutic ally. So it's really important that my patients understand what's going on with them so they can be empowered to take control of their health. And then I'm kind of like, co-creating with them their treatment plan. And that takes time. And our current system is more like an assembly line production. It's how fast can you go, how fast can you see people and get them in and get them out. And so the part that you don't have a lot of is that time it takes to consult with people, which is really where the healing starts. In medicine, one of the most important things is to get an accurate diagnosis. And we know that 85% of a diagnosis comes from what's called taking a good history. And all the history is you as a patient are sitting there and you're talking to the doctor and you're telling them what's going on with you, and the doctor is listening to you and asking you questions to get an idea of what it is and what it's not. So that's really the most important time, and I think that the doctor-patient relationship is sacred. And that's the part that in our current system isn't being valued. So we value cutting people, we value procedures, but we don't value the time it takes to consult someone where you can help them change their life. So as all this was going kind of in the clinic, I started asking around to some of my mentors, you said this was going to get easier, with time. And I became more efficient in seeing patients, but the paperwork side of things and the new hoops that we had to kind of jump through got more and more and higher. And again, I kept having to hire more people, not for patient care, but to deal with the paperwork and the bureaucracy of things. And I realized that, as much as I loved, my staff, my growing staff, that most of them weren't actually involved in, or a lot of them weren't involved in actually taking care of the patient. But the doctor-patient relationship was the relationship that had to fund, all of that growth. So at the same time, I was built this amazing team, and I wanted to, as a small business owner, I wanted to give them benefits. I wanted to show them that I appreciated their service. So I looked into what it would cost to provide health insurance for my team, and it was going to cost about $30,000, which was cost prohibitive for me. And I realized that 90% of what people go to the hospital for or go to the doctor for is actually primary care. So it's your coughs, your colds, your diabetes, your high blood pressure, your cholesterol, your COPD, your asthma, all those things that primary care physicians diagnose and treat every single day. So what I really needed for my staff was to have another physician that I could send them to, and that I could pay that physician directly and negotiate for anything that wasn't primary care. What also happened, around September of 2014, I got a contract in the mail. And it was from the area's largest insurance company. Now, my personal insurance was with them, and my premium had gone up 10%. And then I got the contract as a physician with a 40% cut. And I realized at that moment that I had built my business on quicksand. That when another entity, a third party, could make a decision that effectively could put me out of business, I wasn't working for myself, I wasn't working for my patients, I was working for them. So I called around to my mentors again, and I said, what are you guys doing? And they basically said, you either sell or you sign it. They own this community. So I had a decision to make. I could sign this contract with the 40% cut, and I could double how many patients I saw per day and spend like 7 minutes with everyone, which is the kind of doctor that I never wanted to be in the first place. I could fire all my staff to try and make it work financially. I could sell to another organization and kind of lose control of the healing environment and still be probably in that assembly line mode of medicine where you're seeing a patient every 7 minutes and you're timed for everything. Or I could leave medicine altogether. I could go back to being a decorating consultant, which is what I did before medicine. Or I could do something radically different. I could actually take a stand for the doctor-patient relationship, and that's exactly what I decided to do. So in 2015, we transitioned and became the first direct primary care office in Volusia County. So the main idea behind direct primary care So the main idea behind direct primary care is this. We know that 90% of what people go to the doctor for is primary care. Direct primary care offers comprehensive primary care, all those primary care services, whether it's diabetes management, cholesterol, high blood pressure, well woman exams, physicals, you name it, is all covered for a flat monthly fee, an affordable monthly rate. No hassles, no copays, no deductibles. It's completely simple. And it operates very similarly to like a gym membership. So if you go to a gym, you have all the equipment there, and as long as you're a member of that gym, you can use whatever is in there. And so our office works very similarly. You can come in, and as long as you're a member of the office, if you need an EKG, if you need a spirometry to check your lung function, if you need to get a urinalysis, if you just need to see me, whether you're coming in to have an in-person exam or you need to do a virtual visit, all of that is covered, and it's covered through a convenient membership through a flat monthly rate. So unlike traditional practices, our patients get same or next day appointments. They get longer one-on-one time with the doctor. They have 24/7 ability to communicate with the office. It includes their basic labs. So those labs that check for things like diabetes and high cholesterol and thyroid are all included. And it allows them also to really have that peace of mind, knowing that their primary care is covered. And they can use their insurance for the big stuff. Because when we think about insurance, we know that we don't use our car insurance every time we get a door ding or an oil change. We don't file a car insurance claim for those. So it begs the question, why are we filing a health insurance claim every time we have a sinus infection, every time we have a diabetic visit, every time we need a physical? Why are we filing a claim for every little thing? Why don't we use it more like we use our car insurance or our homeowner's insurance or any other insurance? And make sure that we have insurance for the big stuff, but use kind of like a maintenance plan for everything else. So we've been taking care, we cater to both individuals and to businesses. So we offered our first level, Access Wellness, is our direct primary care level, covers all of the visits to the doctor's office. So regardless of what they're coming in for, it's covered, unlimited throughout the month. Covers their basic labs. They get to have access to the doctor's office. And they can do those virtual visits anytime during office hours. And then we realized, that employers needed to have access to something like this as well. So we started Healthy Employees. And Healthy Employees is very similar to Access Wellness. It's an employer-sponsored version of the program. So employers who want to offer a health benefit that's extremely valuable but also very cost-effective can offer our program to their employees. Covers all their visits, covers their basic labs. If they want to do a virtual visit so they don't have to physically leave the office in order to get the care they need, they can do that. And also with Healthy Employees, because we're working both with the employer and working one-on-one with each employee, we also come in and we do wellness presentations. So we can look at an employer's history. If they've been offering health insurance in the past, we can look at, what are the diseases that are costing you the most money? And we can create wellness presentations that really speak to that, so that we can work on that on a broad level. At the same time, we're working individually with each individual person to help with behavior change. Because wellness presentations are great information, but it's really the behavior change that is most important in terms of changing a lifestyle, decreasing all of those health problems that, if left by themselves, continue to get worse and lead to those down the road high spending. So it really allows business owners who want to either kind of offer this in place of their benefit, or for those business owners who have more than 50 employees and they have to provide insurance, it allows them to really go with one of those kind of minimal essential coverage type of plans, those catastrophic type of plans, that by itself isn't considered great insurance, but coupled with our direct primary care program becomes kind of like the Cadillac of health benefits. And it really allows the employer to be seen and held in higher esteem by their employees who are seeing them getting this fantastic benefit. We also offer a Premier program, which is Premier Concierge Medicine. And that program is really for people who are peak performers who would benefit from having, they know that time is their one non-renewable resource, and that they would benefit from having 24/7 access to their personal physician. So these individuals have 24/7 access to my personal email, my personal cell phone at all times. They can do virtual visits anywhere in the world as long as they have Wi-Fi. It also allows them to do health coaching with me. So in addition to my board certifications, I'm also certified in coaching. And so I work with individuals to really help them move, to get the barriers out of the way and move forward whatever they're trying to move forward with, specific to their health. And so it allows them to really continue to operate at kind of peak performance, peak condition. So we've been growing steadily since we launched. We launched in our official date was March of 2015. And we've been growing since then. And we've been happy with our current growth, but we would like to grow even more. We'd like to serve even more people. So one of the things I would like to know from you is, one, what is your ideal clinic? If you had a magic wand and you could have whatever you want, what would you want? And also, who do you know? Who do you know who would benefit from having same or next day appointments, longer one-on-one time with their doctor, 24/7 ability to communicate with the doctor, convenient virtual visits so they can get health care when they're traveling, or they just don't feel like coming into the clinic, all covered for an innovative flat monthly rate. And what business owners do you know who would like to offer this either as their health benefit to their employees, or as a way to enhance their current health benefit and decrease their total kind of overall healthcare spend?
All right, thank you very much.
Great.